least 1,300 Indians die every day because of cancer. Does this number shock you? Then listen to the next one. More than 1 million cancer cases are reported in India every year. The two biggest challenges associated with the problem: lack of oncologists and access to proper cancer care. There are only 200 oncologists per 1 million patients in India. Due to the dearth of medical professionals, ill-equipped hospitals, and expensive medical care, eliminating cancer is becoming a big challenge. 70% of the total Indian population lives in rural India, but 95% of the cancer care facilities are in urban India. There is an unequal distribution of healthcare centers and medical staff for cancer care. People from rural India have to face physical hardships as they access cancer care facilities in big cities. Amidst the global pandemic, due to lockdown, new challenges have emerged for cancer patients. Many have just perished because they couldn't access the facilities. Mumbai is an example. The city has reported 1.78 million COVID cases to date, and traveling through Mumbai or finding a bed in a hospital had become next to impossible. There is a need for cancer literacy among people. In most cases, people fail in detecting cancer at an early stage. It worsens the situation. With proper awareness drives, the management and prevention of cancer can become a lot easier. People will be more aware of the causes and symptoms related to the diseases and make appropriate changes in their lifestyles. Fighting cancer is a global challenge, and so far, the world is losing. Making it into a win will be the responsibility of every government. Until then, they need to stop boasting on how well they're doing. Bureau Report, Democracy News Live, New Delhi. Cancer has been a battle that many countries have lost. India is no different. India has been losing this battle. There are tremendous amount of cases around cancer. The research has been good, but access to healthcare, access to treatment has been a difficult one. Many times I've gone, in hospitals around Delhi and other cities like Mumbai, and I've seen patients lying on the side of the road, waiting to access the treatment. There are long lineups, long queues. People are waiting. They come from rural India because they can't get in any of these facilities in rural hospitals. Rural medicine is certainly abysmal. And what happens is then, how does one fix this? There are a few organizations, there are a few people. We brought some of those people together here on this show who are going to talk about what the challenges are, how they're fighting this war, and what's the plan as we move forward. They certainly have made efforts. That's not enough. This country is large and it needs tremendous amount of effort. Joining us on the show is Dr. Dinesh Pendharkar. He's on traveling today. He's on his way back from Varanasi, so his network's a bit sketchy. He's a director of oncology at Ahluwalia Cancer Institute. He's also the chairman of the National Cancer Society. Also joining us is Anchal Sharma. She's a cancer survivor. She's a founder of NGO called Meals of Happiness, and also CanHeal for cancer patients. Also joining us is Mrs. Ruby Ahluwalia. She is a bureaucrat from the 1987 batch. She's a cancer survivor, and she's founded the organization called Sanjeevani, Life Beyond Cancer. Thank you, all of you, for joining us on the show today. Dr. Pendharkar, let me start by asking you. You made some tremendous effort around cancer and what you're doing, with district centers. Can you shed a little light on what is your kind of outreach? What have you been doing? Dr. Pendharkar, your audio is not coming through. Let me go to Ruby. Ruby, can you shed a little light on what's happening on the ground and how did you help patients through the pandemic?
Actually, Rohit, when the COVID happened and the lockdowns happened, in cancer, when the patient goes to the hospital, the doctors tell them that your treatment should have started yesterday, because cancer spreads like fire in the body. So you need to, immediately get on the treatment. With this kind of a thing, just the next day the lockdown happens and the hospitals are closed and they are not able to reach the doctors. With this knowledge in their mind that their cancer is spreading on a minute to minute basis, to have this uncertainty that I do not know when my treatment will start, I think that became a very, very important and a very disastrous development, if you ask me. And we started getting calls in thousands from the patients where they were so pained because of the uncertainty which was there. And for a very long time, the treatments were suspended. And even if, when they started, they initially started in a sketchy way, and it has still not normalized, because we work pan India in Sanjeevani, and the patients are extremely pained.
I know, Ruby, you helped tremendous amount of patients through the pandemic. I was having this conversation yesterday. Over 80,000 patients accessed care through Sanjeevani. Explain to me, how have you gotten this all together? How have you gotten the resources together? Does the government, weigh in and make sure that it is able to deliver to the patients that, couldn't really access this treatment at a very critical time?
So Sanjeevani took precisely 2 days to realign, and we started talking to patients. We started telecounseling patients, and if you look at the whole of the COVID period till now, we have telecounseled more than 80,000 patients by now. During this time. And apart from that, Rohit, we run this immunity building program for the patients, which really helps them in their treatment and also in managing the side effects of the treatment and their cancer as well. So even that, we took it on the virtual platform, which is an interactive platform. And we started having sessions on psychotherapy, on nutrition, on yoga and pranayam, on pain management. And we also started bringing doctors on our virtual platform where the patients could talk to them. And since telemedicine was legalized, it became possible for the doctors to have a look at the reports and suggest medicines which could give them immediate relief. So we immediately got on to the virtual platform, and we have helped more than, as I was telling you, 80,000 patients through telecounseling and more than 30,000 patients through our immunity building program. As a result of this virtual shift which happened, our reach has increased. So otherwise, Sanjeevani was working in 15 cities across 12 states. But today we are literally working in every village of the country because patients are logging in from everywhere. We have more than 150 patients who log in every day on our online platform for an interactive session, even today.
Let me bring in Anchal here. Anchal, can you shed a little light? You went through a very tough cancer phase yourself. Explain to me, how tough was it to find cancer treatment in India, and what was the quality of the treatment, and how difficult was it?
Thank you, Rohit, for asking me this question. In 2017, I was diagnosed with third stage breast cancer, and at that time, I don't know much about it because I realized that lump in my breast 1 year ago. It was the size of peanut. But I believe we are lacking of self-examination and more information on cancer these days. I know there was a lump and I ignored it for good 1 year. And after 1 year, it was reached to third stage. And I remember looking for a right doctor is very difficult here. Again, people have lots of advice. Somebody suggested me to start a homeopathy. Somebody suggested me to start a allopathy. And I start for good 1 year, I started a homeopathy treatment, and because of that, also I believe it reached to a worse condition. And doctor is, I keep asking a doctor that should I go through all the tests and then we go further for our treatment, and he's telling me, no, no, Achal, it's okay. It might be a milk clot, it might be a fibroid. It's not possible in your age that you will get breast cancer. So because of that, I get into my worst phase, and I believe again, as I said, we are lacking of information. Even a couple of doctors, when they don't give us the right advice, that is the biggest mistake, I think. Biggest issue which we face. Like I'm not very well educated, and person like me, like you can compare me with the rural area area. A person coming from a rural area. So for me, people like me, we need a lots of for people who are educated, still they have lots of information on Facebook, on Instagram, or on lots of other social handles, right? But people like us, I think we need a right doctor, right platform, a platform like a Sanjeevani, who can guide us. Where should we go, whom should we approach, what treatment we should start first, how we do the clinical test first. So yes, it's a lacking of right information, and because of that, I have to sold out my house, my car, my gold, and it's really very expensive. And if I don't have all these those things with me, I don't know I could have survived or not, or I would sitting in front of you or not. Yeah.
How
So
difficult
yes,
was
finance.
it when you're going to the hospitals, Anchal, dealing with the hospitals, the doctors, getting access to the treatment? And you've seen a lot of people. You go, I know you work even in AIMS
Yeah.
serving food to patients even today. Explain to me how difficult it is for a cancer patient that comes from rural India.
Sir, it's really very difficult. Actually, I have been through, the trauma, but somehow, I get this motivation that no, actually, you cannot give up. But apart of that, it's a challenge to, I believe in hospital also there is no right guidance we get, because uh, you are going one counter to other counter to other, and they are not guiding us properly, that where to go for a PET scan, where to go for a CT scan, where to go for a doctor. So coming from a rural area, not having any knowledge, I think the hospital should provide such a uh, you know department where a person can guide it, आपको कहाँ पे क्या ट्रीटमेंट कराना है, एंड वेयर यू शुड गो, वेयर यू विल मीट दिस पर्टिकुलर treatment. So it's a very painful thing, because I have seen around me everybody is sitting all alone, and people are in pain, crying, and chemo have lots of side effects. Like during my treatment, my body gets weak like anything, and I remember I am not able to walk properly, and I remember there are lots of pain. I'm having pain in my back, my hair start falling, and my skin get completely 10 times darker than today's time. So uh, then the that fear, more than the medicine and treatment, I would like to say, Rohit sir, people around us, they are more scary than disease, because the kind of comment and judgments they tell us, oh, you have diagnosed with the cancer, you're going to die, though you survive, but you are going to die, because they are telling you in that way. So I have came across lots of people like that, which are demotivating me a lot. And I believe if you are telling a cancer patient and giving this kind of reaction, that is more painful, and uh, that is something which is actually make them lose the hope that they will survive. That's the reason we all think, once we get to know that we have diagnosed with cancer, so that means first thing came in my mind, or anyone else mind, that oh god, we are done, we are going to die now. So yes,
Mm,
that is more
mm.
painful than the treatment. So
You
yes,
know,
we all
you're
need to
making a very
understand.
good point, Anchal. I think health communication is something that's missing at a very, very large level across this country.
Right.
Communication with somebody is not well, and what kind of support they
Yeah.
need is certainly missing. But we're going to
Right.
concentrate a little more around the idea of when somebody is diagnosed with cancer. Now, when
Mm-hmm.
somebody is diagnosed with cancer is one thing, but getting a
Right.
diagnosis is not easy. Uh, there are facilities lacking. I know Dr. Pendharkar's audio is not good today, but let me tell a bit about what he does. He's set up some 200 district centers where they deliver treatment locally. Instead of people having to come to big cities like Delhi, Mumbai, Bangalore, Calcutta, they get this treatment in those small centers in villages. And I think it's a tremendous amount of work. I know Dr. Pendharkar is there. I don't know, Dr. Pendharkar, if your audio is up, can we try and get a little sense from you if in terms of what you exactly do? Go ahead, Dr. Pendharkar, tell us a bit about what you do. All right, I don't think his audio is coming through. So, having small remote district centers. Ruby, if I can come back to you, explain to me what is the kind of access in rural India that's missing, which needs to change. We know it is not there. I have carried patients from across this country back to Delhi in my vehicle. Even small injuries, forget cancer. For cancer, they automatically just land here. Every now and then, people from UP will call me, I'm coming to the city, can you help me arrange a bed? And obviously, I'll make a few calls and we'll try and get them a bed. But what needs to change? Why doesn't the government listen and understand that things need to change on the ground in rural India?
So, as far as rural India is concerned, Rohit, there are three, four problems which are there and which need to be addressed. I'm sure government is trying its bit, but there is much more needs to be done. Now, the issues are one is of accessibility. Now, accessibility to the diagnostic centers. First thing that the cancer needs to be diagnosed properly. The primary healthcare centers which are there in the villages, most of the time the staff there and the doctors there, they are not trained adequately to diagnose cancer in early stages. So a lot of time gets wasted out there. By the time the patient is able to travel to a city for his treatment, then he has those problems, whether it is accommodation, whether reaching the right doctor. Even if he has reached the right doctor, how does he navigate his treatment? Then this treatment is very long and it is expensive, even if all the help which is available in the government hospitals, patients do need to spend on their staying, on their food, and some bit of the tests which have to happen outside. So that is another problem. The another very important thing is that these people in the rural areas are not aware about the early symptoms of cancer. They do not know that this particular tumor that they are able to feel, this can be cancerous. So a lot of work needs to happen, I think, in the field of awareness for patients to know. And also, if their cancer is diagnosed, what is the next step that they need to take now? All right, I have been diagnosed with cancer, now where do I go? And after I reach there, what do I do? So those set protocols, I think, are extremely important. And because of this, a lot of people from the rural areas fall into the trap of coax, and a lot of time gets wasted, and by the time they reach the hospital, their case has become so bad that a treatment which could have probably been completed at 6 months, it takes years, and then also we are not able to save the patients. So a lot of work has to happen in the field of awareness. A lot of work has to happen in making the primary healthcare center staff aware of the early symptoms of cancer. The health workers, the Anganwadi workers, they need to know more about cancer for the rural people to reach in the right time, to which is also a very sad thing, because you have taken some chemotherapy, then you have gone back and you have left the treatment in between. This chemotherapy acts as poison inside you, and This really kind of leads to tumors becoming wounds, actually. And I have seen patients with maggots in their wounds, so they reach those stages and they do not know how to get over them.
You're
So a
making a
lot of
very,
work
very
has.
important point, Ruby. I think early detection is one of the most important things of cancer, understanding and recovery out of that cancer. And that's something which is tremendously missing in India. Early detection, because uh, you don't go right away to the hospital. There isn't a doctor looking at you and saying, "I'm sorry, I think you're a possible patient of cancer. You need to be going in and getting that treatment, the test right now. We need to get your report in 2 days, and if need be, we need to start your treatment ASAP." That information is missing. People waste a lot of time in finding out. By the time they find out, it's already too late. Cancer grows way too quickly for, it has to be arrested fast. And then those are all challenge areas. What Anchal told us as well was our small peanut sized cancer became much larger much sooner, because she thought it wasn't cancer, maybe it's just a little bit of a lump. But each lump on the body needs to be looked after. Lump needs to be, taken care of. The testing has to happen. And I think that's where one of our missing links is. One is early detection, two is accessibility, like you mentioned as well, Ruby. Accessibility
Rohit,
to
there is
treatment.
a
Sorry.
sorry.
Sorry, go ahead, Ruby. Go ahead, please.
There is one more point that I wanted to make. Another awareness which is extremely important for people is that cancer is curable. So there are a lot of people who get to know that they have a cancerous tumor, but they don't go for the treatment because they feel that they would be spending a
Fortunes.
fortune on their treatment, and they will not even survive. So what is the point? So more survivor stories, I think, have to go out. People need to
Yeah.
know that cancer is now curable. In fact, because of this, now we run a separate program called CanChetna, where we are doing awareness sessions even virtually during the COVID period. We are doing 8 to 10 awareness sessions every day in colleges and communities, and reaching out to more than 1,500 people every day. And the awareness which is happening is on three things. One is how can they reduce the probability of an incident of cancer in their life? What kind of lifestyle to follow? The
Can
second
you
is
can
what
you
they,
can you please stress a bit on that? Tell me what is that you need to do to reduce the possibility of a cancer?
Rohit, what is happening is that there are textbook causes of cancer which are talked about. So, which are consuming tobacco, smoking, obesity, in terms of breast cancer, not getting married at the right time, or not feeding your children. These are the textbook causes. But mostly these days, you have cancers which do not have any of the textbook causes. So, if they do not have any of the top textbook causes, there are a lot. So, immunity has a huge role to play in this whole game of cancer, which has been missed for a very long time. And so the sessions that we do, we talk about the immunity, and the immunity broadly depends on three things. One is the food that you eat. Second is the oxygen which goes inside you. The right breathing, the exercise, the physical exercise. And the third is your mental constructs. When you are under stress, when you are under anxiety, when you are angry, that is the time you are damaging your body like anything. We do not realize this. We think that if we are not smoking, we are not drinking, we are not chewing tobacco, we are going to the gym for 1.5 hours in a day, we are doing good. But no, we are not doing good. And nutritious food, we do not have the right knowledge of the nutritious food. We think that taking protein shakes, having a lot of non-vegetarian food, taking a lot of eggs is what is nutritious. No, it is
No,
not.
no.
Food which you are able to digest within 2 hours of your eating is what gets absorbed, and that is what makes your growth hormones. The food which is wasted basically gets rotten, increases the toxicity in the system on which the cancer cells thrive.
Wow,
So
wow.
the right ways how to increase your immunity are also very important to be told to the people. So this is one thing which we do with
Sure,
the colleges
sure.
and the communities.
Ruby, I think you made some extremely good points. Now, you raised the idea and talked about how there is lack of information. Anchal, you faced lack of information for a long time. If you were to tell somebody who is fighting cancer today, or
Mhm.
is diagnosed with early cancer, or maybe they have signs of cancer, what would you first tell them to do right away, as soon as possible?
So first thing, like Ruby ma'am said very well that people have this thing in their mind that once they diagnose with their with cancer, they'll gonna die. No, it's not true at all. We are seeing only a death rate. We are not seeing a survival rate as well, because cancer is actually a most curable, especially a breast cancer is the most curable cancer. So my first thing is to advise their family and friends to not overreact actually around them, because sometimes we are expecting too much from the cancer patient, which also take a toll on their health. Every time we have so much of expectation, like you have to be you have to be positive, of course, but you can't ask that person all the time as laughing and doing something which makes you happy, that patient is happy. No, it's okay to be react sometime, it's okay to be cry, it's okay to be sad, and I believe patient should share all these things with their family members, and they should understand. Like my mother used to does when I was in pain and having that bad cramps, and my my fingers are falling apart, like some still I face that issue with me. So my fingers are start falling apart like this thing, and I cannot do anything, and it's start paining, it's like unbearable pain. So I'm crying, and my mother is like, okay, you cry, I'll make a tea for you till the time you cry. So we need that kind of support from family, and family also need to understand when we lose hair. That is where people, today's time also people are not. I meet lots of cancer patients, Rohit sir. I'm meeting lots of cancer patients who are not ready for treatment, who are not, discussed. They are hiding that they have diagnosed with the cancer patient. So family should support them when they lose their hair. It's okay to be lose their hair, and they don't come out of their room. They locked even one year, for 1 year, for good 2 year themselves inside the room, not going out, no communication with anyone in the family, even outside. So these all things need to be changed. We should also conduct lots of activity among the cancer community, to call lots of cancer patients and do activities like, where they can exchange their energies and talk more about things, how one go through, आपने कैसे deal किया, how you deal with it, how your family support. We should conduct more and more informationary workshop for the cancer patient. So that's what we are doing. And yes, don't deal your cancer patient like a cancer patient. It's just like a normal disease, maybe more aggressive, but curable at the same time also. And one more thing, so people here don't do self examination, which is very much important. People is still from a rural or urban society still don't talk about the productive organs, which is really sad that it's a part of our body. I believe my body is my temple. If I cannot talk about my productive organs, who care? Who else care? So that's my points
Absolutely.
only. So
Absolutely.
yeah, one should have
Absolutely.
to start talking.
Absolutely.
And sir,
Thank you
I want to
both.
share one more
Sure.
experience with you,
Sure.
sir.
Sure, please.
Recently, 15 days ago, I was coming back to my home, and I heard one show on radio, Mirchi or Radio FM somewhere, and it's really sad. I really want this thing should go out. So they are doing some cancer awareness show, and anchor asked one of the very renowned doctor that statics on cancer survival rate. So he was like, what is the survival rate for second stage? What is the survival rate for third stage? What is the survival rate for initial stage? And it's very shocking that for a doctor talking on a public platform, a survival rate, you cannot imagine. Maybe some of the cancer patient is listening their show regularly for the more information, right? But they're talking straight away. He said, initial stage have a 90% survival rate. Third stage has 25% survival rate. So you don't know what cancer patient is going through at that time. How can you talk publicly? I'm not saying you are not, you are saying you are talking something negative, but you should not talk survival rate at least on a public platform. It can affect directly cancer patient, it can affect directly their family members. And also, I believe, if I know the survival rate, why would I waste my parents' money? Why would I waste any financial money for a cancer treatment? I don't know. Maybe I know that
Yeah.
I'm going to die. Doctor already mentioned that. So I should not
Mm.
waste. I'll save that money for my family members. So one should not talk publicly on such a topics, I believe.
I think just communication, health communication is a challenge around India. I've seen this
Yeah,
tremendously. It is people aren't educated what to talk with the patient.
right,
How will they help? How will they actually push the patient down? Our
right,
bigger challenge today, which we were discussing obviously, is access to healthcare, cancer healthcare in rural India, accessibility. Lot more needs to be done for making sure we deliver cancer treatment to people, diagnosis to people in rural India, which is a big challenge area. We've seen tremendous amount of people suffer and die. Many of them have died because they didn't get access to the treatment during the COVID phase. I want to thank you both, Ruby and Anchal, for joining me for the show. Dr. Pendharkar, I know he was traveling on the road, so he wasn't able to make it. But thank you very much for raising awareness, getting us up to speed. I appreciate your time. Thank you very much. Good night and good luck.